it's Jen, the Holistic Health Boss, your functional diagnostic health practitioner and expert, and I want to talk to you guys this week about how you can take empowered action right now. So if you're tired of feeling stuck, frustrated, and like you don't have any options when it comes to your healthcare, that's what we're talking about this week. Do you feel as though you're handcuffed by your health insurance and you worry about health expenses, but you want access to alternative holistic health practices? I'm gonna give you tips for that. And if you just know that something just isn't right with your body and you need help investigating it and interpreting what it is that you need and what you need to do, we're gonna talk about that too. Also, if you're feeling a lack of confidence or disempowered when it comes to asking your doctors to run the right tests that you want or for alternative treatments and for the support that you need, I'm going to address that as well this week, because right now it's insurance open enrollment season here in the United States, and it's a time of year to take empowered action when it comes to your health. So I myself have been through the health insurance ringer, and I know just how frustrating the system can be, how it can leave you feeling like you're out of options and basically out of luck most of the times. Now, I've grown to know the insurance system more over the years, more intimately than I had ever intentionally planned, from dealing with various health conditions such as skin cancer, ear infections, allergies, hormone imbalances, Hashimoto's, and even mold illness. And I was fortunate enough to gain a deeper understanding of insurance plans when I worked as the VP of Strategic Wellness Planning back in my old corporate wellness days a long time ago. After sitting through basically long hours of repetitive open enrollment presentations for the corporate wellness company accounts that I oversaw back then, I finally was able to get a better grasp on how to become more empowered in my health insurance options and therefore in my health as well from the knowledge that I gained through that experience. But before I dive into how you can take empowered action with your health insurance and become more empowered in your health, let's get a few things straight first of all, okay? So number one is I want you to trust your body, because nobody knows your body like you do. Absolutely nobody. Your body wants to be in balance. It wants to work for you, not against you. And symptoms are a last sign that show up in a disease or dysfunctional state, and they can be far removed from the cause or the contributing factors, okay? So if something doesn't feel right or you just don't feel like yourself, don't let anyone tell you that you're fine. For the longest time, I was a picture of perfect health according to my typical primary care conventional doctor, even though I didn't feel like myself. And come to find out, there was an unhealthy storm brewing in my body that led to skin cancer, Hashimoto's, and hormone imbalances. So once I started trusting my body and not taking no for an answer, I finally gained the courage that I needed to seek therapies I needed to actually get well again. Now, concept number two is I want you to stand up to the system and start viewing doctors as if you would any other service provider. Sure, doctors have gone to school to specialize in medicine, but that doesn't mean that they know everything or that they specialize in what it is that you need them to specialize in. On average, it takes 18 years for new research to hit mainstream medicine, and even more time for physicians to actually put that new information into play. So there's a huge lag time, right? Know that you have a right to choose a doctor that serves your greater good, to fire them if they aren't doing a good job, and to find one who meets your needs better, right? You also have a right to be educated, to share your knowledge with your doctor, and for them to respect the research and the knowledge that you have. So I like to relate this to, if you got a bad massage or a haircut, chances are you wouldn't go back to that service provider. And we should start holding the same standards to our healthcare providers. And so don't settle for anything less than what you deserve when it comes to your health and well-being. So once you get a handle on these two very important aspects of health empowerment, you'll be ready to take on the system and take more empowered action when it comes to your healthcare or your health insurance. So this week, I want to kind of give you more tips to navigate the health insurance system and resources to help you find the right practitioner to meet your needs, okay? So let's talk about how basically that having the right type of health insurance to back you up is a big piece of the empowerment puzzle when it comes to your healthcare, right? So I find that most people have no idea what kind of insurance they have, let alone what benefits that they have with this. This is always mind-boggling to me. Now, in the US, there are 2 basic types of insurance plans, and one can come with a huge optional bonus benefit. So first of all, we have HMO plans, which are health maintenance organization type of plans. And the biggest advantage to these are that the premiums are generally lower, so your monthly payment, and there's usually a low or no deductible. Now, the biggest disadvantage is that they are less flexible with coverage. There's no coverage outside of the HMO network, and you need a referral from your primary care physician for anything that you want, like a specialty or anything. Now, the other type of insurance plan is a PPO, or a preferred provider organization. And the biggest advantage here is more flexibility and coverage for alternative things outside of network. The biggest disadvantage is the premiums or the monthly payments tend to be a little bit higher, and there tends to be a deductible with this. Now, there's also an HSA high deductible PPO, and the bonus benefit here is there's a tax advantage medical savings account called the health savings account that can come along with this. So the biggest advantage is that you get to set aside pre-tax dollars that you'll have forever. It's not a use it or lose it plan like an FSH or FSA, and these funds can be used to pay for diagnostic testing, prescription medications, and most alternative therapies such as acupuncture, supplements, and more. Now, the biggest disadvantage to this plan is there's usually a high deductible with the PPO. However, you can use your health savings account funds to cover this, and this is the type of plan that I have. So when you're shopping for changing your insurance or getting new insurance, you want to consider a few things. Like, what is most important to you? Having flexibility to see the doctors that you want when you want, that would be a PPO plan, or saving money on a monthly basis for an HMO plan. Do you want coverage for alternative treatments under a PPO plan or not, which would be most HMOs? And would setting aside money to help when things pop up or to give you worry-free spending in an HSA plan be helpful? And you also want to make sure that you review the full plan of explanation of benefits and exclusions to make sure that your needs are met with whatever your insurance plan is. Because knowledge is power, and with technology these days, we have a wealth of knowledge at our fingertips to empower us in our health. So get to know your benefit options and choose one that gives you what you need specifically and what you're looking for. So for example, with technology and knowledge, by doing a simple Google search on what thyroid markers indicate Hashimoto's, there's a plethora of links and resources indicating that TSH and T4 just aren't the best indicators, but yet most conventional doctors will still run those and miss the mark for Hashimoto's all the time. So the final piece of being truly empowered is making sure that you have a healthcare practitioner or partner who has you in mind. And I always say that finding the right health practitioner is like dating. You have to date a few to see if they're the right fit for you and if they meet your needs. And this is true for any doctor, chiropractor, acupuncturist, personal trainer, massage therapist, health coach, or other type of health practitioner that you might be looking for. The most important things that I want in my personal healthcare practitioners to value are collaboration. We need to work together on my health. Teamwork, they have to be willing to work with other specialists for my greater good or for my benefit. Respect, they must respect my choices even if they don't agree with them. Willingness to try new methods as the research evolves. Attentive, so that they're attentive to detail. I want to feel as if they know me and as if they care. So now you know a little bit more to help you take back control of your health, to take empowered action and to be your own health boss. So take advantage of this time of year, this open enrollment season, to either change your insurance benefits to actually benefit you, or to educate yourself more about the ones you have and how you can get the most out of them, and to make sure that you have the right healthcare practitioner by your side. And this goes for all of you outside of the US as well. Know that there are hundreds, if not thousands, of health practitioners like myself who are cheering you on and want you to feel empowered when it comes to your healthcare choices overall. So if you're looking for a health practitioner who has your best interest in mind, then let's see how I can help. You can schedule a complimentary consultation by clicking on the link below or going back to the email where you found this, and we can talk more about this. Because as a functional diagnostic nutrition practitioner, I help health-minded people like you get access to the right lab testing so that they can find the missing pieces to their health puzzle and create a personalized health rebuilding lifestyle to get back to feeling like yourself again, or themselves again. And if you're looking for additional resources to find a great healthcare practitioner, then I also want to point you in the direction to check out the Paleo Physicians Network. So you can go to Paleo Physicians Network or Google that, and the Institute for Functional Medicine, where they both have databases where you can find qualified health practitioners in all different areas and categories that are open and willing to the latest and greatest advancements in the health system, holistic types of approaches, and functional diagnostic testing. Now, I hope that you guys found this really helpful for you this week, and how you can take more empowered action so that you can start 2018 with a bang and getting back to feeling like yourself again, or continuing to improve your health in some kind of way. All right, I'll see you guys next week on the blog.